Good morning. Welcome to Member Focus Monday. I'm Cristina Schaefer, Social Media Manager with HAR. I'm joined again this morning by Dr. Elena Bottazzi with Baylor College of Medicine. Welcome.
Hi, Cristina. Nice to be with you. Far away from
Far away. Yes, you were actually our last in-studio guest. After that, all our guests have been virtual. So thank you for joining us again. Really quickly, for anybody that missed the last time you were on, if you could just introduce yourself and let us know who you are and what you do.
Yeah, certainly. So my name is Elena Bottazzi, and I am a professor at Baylor College of Medicine. But I also co-direct the Texas Children's Center for Vaccine Development. And, I'm not sure if you've seen a few of the news coming out, certainly in the Chronicle and in other places, but we do have a COVID-19 vaccine. And I'm very excited that from the last time we spoke, we have had some good movement, and we're slowly going along and be one of those who are actually in the running for developing such an important vaccine.
Yeah, that's wonderful. Thank you. And thank you for taking time to be with us today. This is actually very timely because Governor Abbott is expected to announce that we've officially moved on to phase 2 this afternoon. So this will be really great information. Since you were last on, there has been more and more information out there to the public regarding coronavirus, but there's also been more misinformation. There's, videos circulating all over social media. Some say the virus might be a conspiracy or, different things regarding that. Based on what you've seen, is there any reason to believe, and based on your experience, is there any reason to believe these rumors or conspiracy theories regarding COVID-19?
Well, look, the reality is the following, right? So we have some key groups of scientists who really understand how to evaluate the evolution or even the, kind of like the genealogy or the genetic footprint of these coronaviruses, right? And in fact, it's interesting, with a group at Baylor, we're also kind of like keeping track of this, not only because I'm sure you're going to ask later about the mutations, but how do you even kind of like understand where this virus really came from and how it was originated. And the bottom line is that no, it is not coming from any man-made attempt of doing anything. I mean, it's clear, even today we're seeing that these sequences are of this COVID-19 virus are very similar from its origin, most likely again from a virus that normally circulates in the bats, for example. We do not see that there has been any genetic manipulation that clearly shows that, it was done, in a laboratory. We're mining again this concept of, all viruses, of course, mutate, different families of viruses mutate in different manners. We humans mutate too, right? I mean, every living organism, that's, every time we duplicate or replicate or our cells, are created. We have that, in our genetic sequence, the ability of making mistakes, because in theory, mutations could be just a mistake in our coding, like when you're doing computer coding the same way, right? Or that indeed it is because we're looking for an advantage to gain, like, including in these concepts of evolutionary, kind of like strength. So I think we have to be very cautious. I mean, clearly, all of you that may not be, of course, science versed on the information, just try to pay attention of where the sources come from. Of course, peer-reviewed, high-level journals that really can attest to where the information comes from is probably more reliable than some story that doesn't have clear information of where the sources come from.
It's difficult because I think some of those videos that we see might be produced for entertainment value, but there's a difference between entertainment and fact. So
yeah, sure. I mean, we can watch all the movies we want, right? They can, they can kind of like make fiction of something, and so we have to just be very careful. Now, that said, there are groups that, that's basically their scientific purpose, to really look very deeply at the genetic codes of all these viruses, as well as many other viruses, and how they can, not only keep track of how they're changing as they are being transmitted, as well as what are these changes and what do these changes eventually may have an impact on. And unfortunately, we're still new. It's still new.
Mm-hmm.
We're still learning. So I think we need just to be a little patient and always be cautious on how you interpret the data, because you can have data, but you need to really be careful of how the data is interpreted.
Yeah, great. That makes sense. So there continue to be people that compare coronavirus to the seasonal flu. Is that a fair comparison?
Look, it's like comparing apples and oranges, right? Clearly, both, of course, are viruses, like many other viruses are, but clearly a flu virus is from a completely different family.
Mm-hmm.
We, of course, as humans have been exposed to flu viruses for a long, long time. We definitely see that indeed, these viruses, not only the different strains of viruses, but even as we were talking before, how different strains of viruses mutate rather than new strains arising, right? That's a different
Mm-hmm.
concept, right? Having already a virus that changes versus a new virus becoming adapted into humans. So I don't think we can compare it. Now, with regards to the question, will eventually coronaviruses or this specific COVID-19 virus
Mm-hmm.
become more seasonal? There's a tendency of thought that could happen, mostly because, again, we were not able to really reduce the circulation of the virus very rapidly, like maybe we did with the prior SARS or even
Mm-hmm.
MERS outbreak. So that's one aspect, right? Because unless you really can reduce it to the point where it kind of disappears, then you don't have maybe the same, likelihood that it's just going to be continuously circulating. I think today we still have seen that we still do not have a disappearance of the virus per se. So we can see reduction of cases, which is great, right? To the point where hopefully one day we can actually see that indeed the circulation is so low that we can even do a better ability of tracing it.
Mm-hmm.
But then this concept of seasonality is right now is most likely that we're seeing, deeps into the transmission and most likely increases in the transmission. And again, this will also be based on, as we were kind of like in shelter in place, now we're relaxing some of these shelter in place.
Mm-hmm.
Is this going to cause that it's going to come back up? What can we then do to track this coming back up, where and how, and then how do we test it? And then eventually, put in, kind of like these seasonal abilities of measuring. Of course, for you to formally establish seasonality, you have to go through the entire seasonality scheme, right? So right now we just had, January, December to now. We're going to have to see what happens in the summer. We're going to have to see what happens in the fall. And then the models also will be more predictive, right?
Mm-hmm.
Models are predictive on the basis of the amount of data that you input in the model. And if the model right now doesn't have a lot of data, you can predict all you want, but, it's still a prediction.
Okay. I had a question regarding face masks. Excuse me. There was a video of Dr. Fauci on 60 Minutes from March where he said Americans didn't need to wear face masks. Then the CDC updated those guidelines in April. Kind of like we were mentioning earlier, check your sources, but that video seems to be recirculating, not realizing that was from March. Dr. Fauci's also been wearing a face mask in any public appearances we've seen him. So what is your current feeling about wearing a mask when you are outside of your home?
Look, I think, again, things, of course, have changed from maybe at the beginning of the year to now. I mean, there was a point where we were also struggling a little bit with ensuring that we had the PPE available
Mm-hmm.
for the first responders, right? And the fact that we were much more drastically sheltered in place, arguably that, was, again, one of the also rationale of, that you, at that time, maybe you didn't really need it, right?
Mm-hmm.
Now, I think, again, because we are hopefully slowly going back into some level of, ability of being outside, I think it is imperative that, one, you as an individual are aware of how you albeit you not even knowing whether you are, transmitting the virus, that you need to protect your, neighbors. And therefore, it's ideal that therefore, if you're outside and in contact with others, that you should be mindful. And therefore, if you use a mask, you clearly are protecting also those that are around you.
Okay.
And the same goes for ultimately protecting yourself, right? So I think it's a little bit of common sense, where you are. I mean, of course, if I'm outside and there's nobody around me, then probably it's not a big deal. But if you're in the supermarket and you have, all sorts of people, walking the aisles, you definitely, probably have to wear a mask, right?
Yeah.
Or when you go to work and you're sitting in your office, probably that's, again, you don't necessarily need to. But the moment that you're with other people, I think it's at least it's, again, one of the steps that you can do to protect you and protect others. And again, there's always the question of what kind of mask and how protective they are. At least, covering your nose and your mouth and, washing your hands, doing the, traditional hygiene, procedures.
Right.
Clearly, of course, are going to have an impact.
Yeah, and somebody actually just Teresa asked, what type of mask?
Again, if you're, of course, a nurse or a first responder, it's clearly very different than if you're just yourself and, going in, to the supermarket. Ideally, you want to have, a mask that definitely is going to, again, limit this concept of transmission. I think people are, there's guidelines of, what happens if you use, a cloth mask or if you use, surgical masks. So I would suggest that you probably look, at what the recommendations come out from our health, state, and city departments. Yeah.
So to that same regard, you were kind of touching on this, that we're going out, but we don't know if we've been exposed, if we're not having symptoms. Tanya said if 60% plus people are without symptoms, how long does the virus stay with people without showing symptoms?
Well, it could actually never show symptoms, right? If you're a healthy person that arguably you manage to get rid of your own infection, you may not even really show any symptoms, right? It's clear that within the population that get infected, you may have those who, of course, stay asymptomatic, those who eventually may have just, a simple common cold-like type of symptoms, and then, unfortunately, there's those who progress into the most severe disease aspects. That's, I think, one thing that we really do not understand. Why you are asymptomatic and never develop severe disease. We already know there are some risk factors that give you the ability of developing severe disease. But that's the issue, right? I mean, the issue with this virus is that if you get it, doesn't necessarily means you're going to get sick, and therefore you don't know that you're even transmitting it, right? And that's why I think we're having a lot of hard time following where this virus is and who's infecting who and the prediction of who will get sick. Right,
that makes sense. Someone did ask, does wearing a mask weaken our immunity in the long run?
No, I mean, wearing a mask, absolutely not. I mean, it's just a barrier, right? For you to inhale or even, just the ability that we can touch our face all the time. At least, you have a mask. Yeah, but that has nothing to do with your immune system.
Very good. Okay, so we'd like to know the status. We heard from you again back at the beginning of March. Where are you in the development of a coronavirus vaccine? I know there's a lot of different organizations working on a vaccine. What is the status?
Yes, well, okay, so here's the running of the field, right? So the good news is, which I think it's actually unprecedented, there's more than 100 groups that are attempting to develop vaccines, both in the US, and all over the world. That's good because that you need to have a lot of, programs, because vaccines, unfortunately, usually at the early stages have a very high rate of failure, just because, biologics in general have very high rates of failures when you start developing them. amongst all these 100 different groups that are developing vaccines, you have to understand that even though we're all attempting to tackle most likely the same Achilles heel on the virus, meaning we're all attempting to block the virus ability to enter human cells. Mm-hmm. And that is being accomplished by targeting, you've heard, the spike protein, or even a piece of the spike protein, which is essential for the virus to enter our cells. But developing vaccines can also use a variety of technologies and platforms. And that's where I think the matrix of all these different programs are distinct to each other. Some people are using what we call full viruses, using live attenuated or even killed viruses. Some people use what we call these technologies like viral vectors to deliver the vaccine. Others use, like recombinant proteins or proteins that we make in our laboratory. Others use these oligonucleotides, and they call them DNA or even RNA vaccines. The reality is that they may all be good, they may all work, we don't know. The thing is that we know that vaccines that already have been approved and are being used in our communities for other diseases, only a few of these technologies have worked before. For example, recombinant proteins we know have worked before. Attenuated viruses or live or kill viruses, we know they have worked before. Some of these other technologies are experimental. So even though it's great that they will be tested, we do not know that they will work.
Okay.
So we have to just be patient. The good news is we're starting to slowly see some that may look like maybe more promising than others. But ultimately, I think we will prevail and we will have, ideally, a good vaccine that can prevent as much as possible the ability of these viruses to infect our cells.
Okay. What is the actual process? Because I know there must be stages. The process from a vaccine from being in development to being available to the general public.
Yes, I think that's another thing that it's a little bit unclear, especially when you hear these news. I don't know if you've heard about some of this news about the warp speed initiative from the White House. Mm-hmm. I mean, there's two components of developing vaccines. There's the component of producing and what's so-called manufacture the vaccines, mm-hmm. and then there's these studies that confirm whether the vaccine in humans and or even in some preclinical models are safe, immunogenic, and effective. Mm-hmm. So when you hear that we are probably going to have vaccines produced or available in the next, 6, 8, 12, 18 months, if you talk about it at the level of manufacturing, mm-hmm. Arguably you can make them, right? You can even work already in scaling them and making sure that we have, and in fact, they've been talking about making vaccines at risk, meaning all these manufacturers are going to make a few of these that are in the testing stage still, and then they're probably going to just keep them in the refrigerator or freezer or wherever in the event that they work. Mm-hmm. I think what the problem is that we're not hearing clearly is that the testing stages are the ones that are, of course, the most, difficult to achieve. Right. You have to go through first safety stages in very small number of people, then they have to enlarge the number, look not only at the safety, but its ability of being immunogenic and efficacious, and eventually enlarge populations to the point where what we call the efficacy trials will need to look at, thousands and thousands of people before we can decide that these vaccines are good for deploying in the general community. And we think that's what is going to take a little longer, mm-hmm. right? So you can have all sorts of vaccines manufactured, stored, because that way, at least if we know one works, it'll be ready to deploy. But the fact that you have them manufactured doesn't mean that they work, right? So mm-hmm. we have to be very careful with the language.
Right. So there was a recent poll of Americans released last week that showed 1/3 of the public would not get the coronavirus vaccine once it becomes available. There have also been reports suggesting various figures on how much of the population must develop immunity, either from actual exposure or a vaccine. Can you explain what herd immunity is? And because also we've heard the World Health Organization stated last week that herd immunity won't protect us. Can you clear that up a little bit for us?
Yeah, I know, and it's a slightly complicated, I guess, concept.
Mm-hmm.
I'm going to try my best. So first, your question on, the fact that, what was, again, repeat me the first piece of the question.
So just if you could explain exactly what herd immunity is.
Okay, so but you had a first question.
Oh, it was about
the hesitancy. Yeah, the hesitancy.
Mm-hmm.
Again, yes, you're right. Unfortunately, in our world, we have, thank God, at least we still have, 2/3 or a lot of people who understand that the fact that you have vaccines
mm-hmm.
and that these vaccines are probably the best public health intervention to prevent very serious
mm-hmm.
diseases, it's very important, right? So the reason why we, in theory, should not have any measles, should not have any, other of these very infectious communicable diseases,
mm-hmm.
It's important to get ourselves vaccinated because, again, as we were discussing, is you already teach your body to have a response ready so that when you get infected with the actual real pathogen, you already know you have an army that already can protect. And one thing is for protecting you to get disease and certainly protect you to die, right?
Mm-hmm.
Some vaccines are what we call 100% protective, meaning they don't even allow the pathogen to infect you,
mm-hmm.
and therefore, of course, no disease. Some vaccines, even though you can still get infected, what they do is they reduce to the point that your disease is not severe, and that's an example of the influenza vaccine. I think people, that's why they claim, oh, why do I get a vaccine and I still get the flu? But remember, you get the vaccine, you get the flu, but you don't get a flu to the point where you die.
Mm-hmm.
And so that's very important to be clear, right? Because you don't know, again, we don't really know who, if you get infected or get a disease, that you, for some reason, have other underlying issues. And even if you think that you're going to be like a superhero and survive, arguably we do not know. And that's why vaccines are valuable even if they're not 100% protective. And so I think we need to advocate for that, and we need to make the population understand that vaccines, that's why they take so long to develop, because they're safe. Mm-hmm. We know that they do something good. Now, with the concept of herd immunity,
mm-hmm.
again, is again this same issue that we're at some level attempting with this whole social distancing, right? So if you give a vaccine to someone and someone has an immune response, which means that even if you get infected, most likely you're not going to transmit that same amount of virus because the virus cannot replicate at the same rate in your body. So you also are shedding less and less virus, meaning you therefore are going to infect somebody else with less amount, or even, you're not going to actually infect. So vaccines, by protecting you, don't allow you to get infected or not infected at the same level, and therefore you shed less and less and less, and therefore you're creating this kind of sort of a bubble where you're protecting your neighbors. Mm. And remember, that's why vaccines are a public health intervention. It's not an individual intervention at the end of the day. You protect you, but most importantly, you're protecting your neighbors. Mm-hmm. And that's why it is important. Now, natural infection, I think you made a reference to, if we get infected naturally and we, of course, at some level do not develop severe disease, is that enough for us to create this herd immunity? I think you're right. We still do not know exactly, because, again, it looks like that those people who are getting infected and don't have severe disease, even though you manage to get rid of the infection, it seems that your protection is not necessarily long-term or strong enough for you not to get, again, reinfected, or right? So it's mm-hmm. the same. You can get the flu today, you can get the flu tomorrow. So, you can get a coronavirus today, you may get another coronavirus tomorrow, and it's because we can tackle it for the short term, but we cannot tackle it for the long run.
Okay, very good. Thank you.
I hope it was clear.
No, that was very clear. In fact, somebody said we're so fortunate to have someone of this level of experience and knowledge sharing with us. So thank you again.
I try the best that I can.
Yes, no. So if you could clear up some more things for us, what's the difference between antibody tests, antigen tests, etc.?
Right. So if you have the actual virus circulating in your body, then there are tests that can detect the pieces of the virus that that's one thing, right?
Mm-hmm.
But then that question again is, if your body mounted a response, even if you don't have the virus currently circulating, you can actually detect with detecting the antibodies if you were either previously exposed or if you have, again, this immunity, whether it can be a short immunity or a long-term immunity. So there's two different things. Either you're detecting the virus,
mm-hmm.
and therefore you theoretically could claim that you have an active infection, or if you detect an antibody, that doesn't necessarily mean that you actually also have the virus, right? Mm-hmm. So I think that's why you have to use them for when it's appropriate, right?
Mm-hmm. That makes sense. Should everyone get tested at this point, or only somebody exhibiting symptoms?
Well, that's debatable in the sense that, if the tests that you use, are very specific and sensitive,
mm-hmm.
You of course, that's one aspect that people are thinking of maybe utilizing just to keep a little bit of who can go back to work and how do you go back to work, right?
Mm-hmm.
And the fact, again, right now, of course, the most important is you don't want somebody who's actively infected and therefore shedding the virus, because, of course, that's the person that can transmit it,
mm-hmm.
right? So ideally, eventually it would be nice to have a test that can detect everybody who have active infections. If you get tested and you show that you have an antibody, that doesn't necessarily mean that you're actively infecting. Mm-hmm. So we need to figure out, which tests should be used on people who, of course, have been exposed, and therefore you want to really, confirm that they're not infectious. And that's the reason why, probably diagnostics also should be very directed to the contact tracing, right? So if you were among someone who have the disease,
mm-hmm.
you probably acquired it. Let's confirm if that's the case.
Mm-hmm.
Let's confirm that you actually have it. I know it's a complicated algorithm, and I know it's hard because we need to balance
mm-hmm.
what tests do we have available, how sensitive and specific they are, so that they don't detect false positives or false negatives, especially.
Mm-hmm.
And then when are they appropriate to be used, in what context, and who should be doing them, and what the purpose for them are going to be.
Okay. I do have another question about recovered patients. What are your thoughts on transfusing plasma from recovered patients to use their antibodies for virus? To fight the virus for other patients.
Yes. So in fact, we've been hearing some really promising news. First of all, there's been already an assessment of more than 5,000 patients who have received, it, as a therapeutic, right?
Mm-hmm.
So they're using it as a potential to at least ameliorate a little bit the tackling the virus infection. And it's safe. It shows certainly a good safety profile, because that's always, again, you have to look at that.
Mm-hmm.
So it's been definitely valuable to reduce a little bit again, if a patient already has it, you're giving a little bit more directed therapy so that they can attempt to tackle the virus infection.
Mm-hmm.
I think we're still trying to understand how much of those antibodies you need to potentially prevent, right?
Mm-hmm.
And that's something that we're also using to learn for our vaccine, right? We know how much titer and neutralizing antibody titers you need in a person to be able to prevent infection. And I think we know we need a lot of antibodies, and they have to be a lot of the good neutralizing antibodies.
Mm-hmm.
So that's we're also learning. But I think If you certainly have been exposed and you want to go to the, Red Cross, or, where they are, evaluating the titers to see whether indeed your blood could help somebody else, that is absolutely something that it's such, there's so many people that are so good, to do this. And at the same time, we're learning a lot, right? How are these antibodies behaving, and so that we can also design better vaccines.
Great, thank you. I know we asked this last time, but is there any additional information regarding whether someone is protected from future infection if they have already been exposed previously?
Yeah, and that's, again, the big question mark, right? Clearly it seems that if you have built this, pool of antibodies, as long as these antibodies are so-called neutralizing, then the question is, again, how much you have, and more importantly is, do you actually have memory, right? Because, the antibodies per se, as far as how long they remain circulating in your body, is one aspect. But then the cells who produce those antibodies, they're considered memory cells, and therefore do they live and persist in a way that when you in the future get another hit by the virus, do these cells recognize it and start producing again these antibodies? And again, we are slowly learning more and more about this. And ideally, that's what the vaccine is really intended to do, to create not only immunity, but long-term immunity. And how much long really means is depending, again, on how many times you give yourself a vaccine, right?
Okay.
There's vaccines you have to boost every so often, and that's another thing we're really studying also.
Great, thank you. I do have just a few, I know your time is very valuable, but we have a few more questions for you and a few more questions from our members. We wanted to ask, because initially there was evidence that children had less severe cases of COVID-19, but the CDC just issued guidance last Thursday on the new Multisystem Inflammatory Syndrome in children, which sounds tragic. What do you know about this new syndrome, and what signs should parents look for?
So look, I'm not a pediatrician as a physician. I actually will suggest you a name of somebody, if you are interested, of Dr. Flor Munoz at Baylor and Texas Children, that she's a pediatrician and can give you a lot of information about this. Of course, we need to be very cautious. We need to learn more and more about this, especially, again, as we're developing, for example, convalescent plasma sera that I know we're actively working indeed with Dr. Munoz and others in Baylor to develop protocols for convalescent sera for children to, indeed attempt to prevent these kinds of situations with natural infection, and also how we're designing our vaccines. So they're definitely looking at this, and so we have to be cautious, and that's the reason why, of course, our children's hospital is also keeping a good eye of this patient population, right? So I suggest that probably if the group is interested in more details about this, we probably, you can have a second version of this webinar with somebody that can talk to you about pediatrics.
Very good. You've mentioned contact tracing a little bit earlier. Some countries have been able to keep their numbers low by instituting contact tracing. Do you think that it would be an effective practice in the United States?
Oh, absolutely. And we're even seeing, even here in Houston, I think they've really ramped up. I think they finally got some funds, some of our public health offices. So that they're definitely going to be ramping up the contact tracing, because that's the key, right? That is what really made the disappearance of SARS and MERS before, albeit that, again, the transmission was a little bit better controlled. So if we manage to understand, the trace of who are the people who have been in contact with somebody who clearly has been transmitting the virus and certainly symptomatic, we can therefore then do these shelters in place or quarantining in a much more organized manner, and even by area, by location, right, and that's why you need to, even yourself, understand where have you been, with whom have you been, how, when, right? because if you for some reason are to get infected, it's ideal, right? The contact tracing is through, okay, where have you been, have you been with, so that you can then follow where it could have come from, right?
Great. I see some questions from our members, a few of them. One, Antonio asked, if a person tests positive but didn't have any symptoms, what is your advice after 14 days?
Well, again, in theory, after 14 days, and you tested positive by virus antigen, right? That they detected you can potentially confirm that you don't have an active infection anymore, at least by detection. And theoretically, you should eventually look at, what kind of immune response did you have? Did you have antibodies against it, right? So, at least you can determine if you're infectious or not.
Sure.
That's the point of the quarantining of 14 days.
Very good. We did have a question too from Bob Hale, our CEO. When would it be safe for schools to reopen?
Oh, again, that's such a tough question, right? And again, it's all on, and you could ask the same question. When are we going to open sports again? When are we going to open, So it's all, again, of understanding who is going where, how you're monitoring, when they go in and out, right? When they go to the school, not only the children, but the teachers, the parents, and where they're going back to, and where those communities are. What's the transmission amongst those communities? How good are we detecting, diagnosing, and therefore, contact tracing? So I think it's going to, again, I think people have to understand it's going to happen, but it has to happen slow and in an organized manner, because you can't just open it up and just have this perception in your head that you can just go back to normal. I think we need to be cautious, see what happens, and then maybe reevaluate the protocols, because I think it's going to be seminal to see where we were at, let's say, a week ago. We're reopening, what the data is going to show in the next 7 to 14 days, and then readjust, right? So it's a constant cycle of readjusting.
Okay. I see several of our members seeking your advice on just ways to stay healthy, boost your immunity, and also even a question about, with Memorial Day being next week, a question about public swimming pools and your thoughts there.
Well, look, staying healthy, it's like normal, right? Eat well. Supposedly I should do this myself, right? Eat well, sleep well, make sure you, exercise well, keep a balance, work-life balance, like we all should be doing. I think, connect with your primary care physician. I think nowadays we have some very good algorithms certainly in our medical center, that we now should go back into, you need to go see your doctors, keep in check, certainly if you have underlying risks, for disease. Again, be aware of your social surroundings. I would probably don't go over, kind of like, open up and say, okay, I'm just going to go and do the same thing as I would have done the same way Memorial Day last year. Just be aware of where you are, who's your community, where is this pool that you're going to go? Is it a pool within your, enclosed, living community? What are they doing? So I think it's just, again, it's a little bit of common sense and being aware of where you are, and not just to assume that, I'm healthy, I'm not going to get infected, but also look at who's around you, right?
Yeah, very good. And I want to remind everyone that NAR does have a telemedicine service that they're offering to all members for free during this time. So if you don't want to go to a doctor, you always have that benefit. You can look it up on NAR's website. So I don't see any other questions for you, Dr. Bottazzi. Just a lot of people thanking you for sharing your knowledge and experience. Do you have anything else that you want to share with our members?
No, I would just suggest, again, stay safe, stay healthy. Again, be mindful. We all live in our wonderful Houston community. We're resilient. And therefore, let's just make sure that we always think about us as a community. So
very good. One more question I did see pop up. Maria asked, are asthmatic individuals more vulnerable to the virus?
Of course, right? Any underlying risk, you have to be very careful, right?
Mm-hmm.
Whether it's, of course, asthma or any other respiratory issues, smoking, high blood pressure, right? I mean, that's definitely, we have to be cautious with that.
Okay. You kind of already touched on this, but any other thoughts on reopening our communities? Any other thoughts about reopening our communities? Is basically the question.
Again, we have to do it slowly, with kind of a little bit of a stop and go, right? You open, see what happens, reevaluate, mm-hmm. right? And not just assume, again, that, this whole reopening gives us, kind of subliminally that we really want to go back to how we were maybe mm-hmm. last year. Remember, it's just not going to be, the same way. So absolutely. Eventually we may reach a nice happy medium. I always say the same, like how we evolve, even with the way we travel, the way we, certainly do things. We probably won't go back to normality, but, we'll adapt and adjust, right? Mm-hmm. All right. To ensure that we have a healthy world.
Thank you. Yeah, thank you for that. So before we go today, we want to show you just a quick video to see how you could be featured on an upcoming Member Focus Monday or on our HAR On the Move podcast.
Hi everyone, thanks for tuning in to today's Member Focus Monday. Did you know that HR has over 37,000 members? If you'd like to be featured in Member Focus Monday, our podcast, our new digital magazine, or one of our virtual classes or events, please reach out to me. I hope today's information provided to you by Dr. Bottazzi has been useful. Remember to stay safe out there. Have a great week. Thank you, Cristina.
So yes, thank you again. And I see another question here, or not a question, just a comment. Thank you for your scientific words of wisdom. And a question about our schools opening. I think we just need to look to the government officials for the answers to those questions. But again, thank you so much for your time today. I know you're very busy, and we all definitely want you to get back to what you need to do and to keep us safe. And hopefully we'll see a vaccine available to the general public soon. Optimism. Yes.
Have a great day, everybody. And
thank you,
Cristina, for the opportunity.
And thank you so much for your time. And thank you all for watching. Next week, again, is Memorial Day, so we will not have a Member Focus Monday next week, but we will see you the following Monday at 9 a.m. Bye-bye.